My name is Swahn, and I'm the Dean of the Wellstar College of Health and Human Services at Kennesaw State University. I joined KSU and the Wellstar College in March 2021, and I have been so grateful for the warm welcome and our strong focus on student success and research with relevance, and I find it to be a true privilege to lead our Wellstar College. As a college, we are growing rapidly, and we have amazing faculty, staff, and students. In terms of research, we are doing great work in many areas, but most notably related to health disparities, trauma, vulnerable populations, youth studies, fitness, and community engagement. My primary research interest is in adolescent and young adult mental health, a topic I have studied for some time. Primarily, I have focused on health risk behaviors, alcohol and drug use, gender-based violence, and mental health concerns. I'm trained as a psychiatric epidemiologist, which is a field within public health that investigates the causes and consequences of mental illness. And in my case, I look at mental illness in a broader context, focusing on the structural drivers and consequences of poor mental health, particularly in vulnerable and understudied populations in low-resource settings. So my research by nature is quite interdisciplinary, and I typically work with researchers who have a range of expertise. An area of great interest to me is how alcohol use and violence, for example, intersect with HIV transmission. This is a research topic I first pursued as a Fulbright scholar at Makerere University in Kampala, Uganda. Over the last 10 to 15 years or so, I have been immersed in global health work. This work has really focused on capacity building for research and alcohol policy development, working with community-based organizations, particularly in West and East Africa. But mostly my recent work in Uganda has been centered around understanding the urban disadvantage and health disparities among youth in the slums of Kampala, the city of 7 hills. Youth in the urban slums across sub-Saharan Africa have largely been neglected from public health research, despite their extensive health disparities and available low-cost interventions. Given rapid urban migration and population growth in Uganda, the number of vulnerable youth who live in the slums are exceeding the availability of government services and support. Basic public health research that describes key risk and contextual factors can identify those most vulnerable and guide low-cost interventions to improve quality of life and mitigate the risk among those that live the urban disadvantage. In the last 5 or so years, there has been a new focus on the urban disadvantage and the context of cities in global health. It has become very obvious to us with the COVID-19 pandemic as an example, how vulnerabilities to a range of health concerns may be exacerbated in cities, specifically in densely populated environments and also those in low-resource settings. So let me tell you a little bit about how this work got started and what my research has focused on regarding the urban disadvantage in the slums of Kampala. And just so you know, Kampala is the capital city of Uganda. It's a landlocked country in sub-Saharan Africa with over 40 million people. And in Uganda, about 50% of the population is 15 years and younger. About 10 years ago, I met Rogers Gaziri, the executive director for the Uganda Youth Development Link. I'd heard him speak at a conference in Denmark and was so surprised when he outlined the high levels of alcohol use and harm in Uganda, a country I knew nearly nothing about. Because I was so interested in learning more and because there's such a shortage of psychiatric epidemiologists in Uganda, Rogers invited me for a visit. During my first visit in 2010, I saw the great work that Rogers and his organization was doing, uplifting youth in the slums through mental health services and through vocational training. But there was so much need, so few resources. It was and still is a very complex environment. And to be honest, I wasn't sure how I could contribute. What could I do to help? Previous to that trip, I had traveled quite a bit, considered myself a world citizen, I was already a mother of 3 children, and I had worked at the CDC as an epidemiologist for 10 years. I thought I had relevant experience, but I just wasn't sure how to move forward and how to best contribute. I returned for a second trip, and this time I was more prepared. I had been briefed by colleagues, and I really knew so much more. We developed a strategy focused on the research needs, and our goal was really to determine the unmet health needs in this understudied population. That second trip proved to be life-changing and was the launch of a new research agenda centered around community mental health, capacity building, and policy development in East Africa. Through these initiatives, I gained so many fantastic collaborators and really a new life, and I believe we have really made a difference. Over the years, we have conducted different research projects, including surveys, focus groups, and community mapping of alcohol marketing and sales. We're also developing new tools to support capacity building and to facilitate new research. One such tool is the slum rating scale, which really simplifies the measurement of alcohol outlets and sales in the urban slums. In terms of the urban disadvantage among youth in the slums, we have written many different papers examining unmet needs pertaining to child maltreatment and sexual exploitation, involvement in sex work, psychological distress, suicide ideation, alcohol use, alcohol marketing, problem drinking and alcohol-related harm, gender-based violence, HIV and other sexually transmitted infections, homelessness, and psychosocial factors associated with service seeking and vocational training. In terms of the structural drivers, a few years ago we had a National Institute of Health grant to examine alcohol marketing in Uganda and found that it is very aggressive. Our analysis of the content of these alcohol ads also showed that many of the alcohol billboards violate industry standards. Uganda, like many other countries in sub-Saharan Africa, have very weak alcohol policies and limited enforcement. As an example, in some settings there is no minimum price for alcohol, and in many cases alcohol is cheaper than water. The work in Uganda has had a positive impact in many ways. We have launched a virtual alcohol, drugs, and addiction research center at the School of Public Health at Makerere University. I also led a study abroad program to Uganda for several years, which enabled my students to participate in our ongoing projects, engage with my collaborators, and of course visit Makerere University. This work has also led to collaborations with organizations across other countries and even allowed me to present at side events for the United Nations Commission on the Status of Women in New York for 3 different years. The community-based organizations that I work with have used the data we have generated to strengthen their services and outreach activities and also to brief decision makers. For example, we have found that alcohol use is a key concern among young girls and women in the slums, and actually a high proportion of these girls who drink alcohol can be classified as problem drinkers, which is a significant concern. We have also found high unmet mental health needs, high levels of distress, sadness, and violence exposures among these girls, which really seem to be driving their alcohol use. Our research has also been used to inform alcohol policy development. I have worked with a writing team assembled by the Ministry of Health in Uganda to draft an alcohol control bill that is still awaiting adoption. I've also briefed other government agencies in Uganda about my work, including the Ministry of Trade, the Ministry of Gender, and also the Kampala Council City Authority. The work has also really transformed me, made me a better person, and led me to approach life with more passion, humility, and appreciation. These past 10 years of global health work have really been a gift to me, and I'm full of gratitude for my collaborations and the many ongoing projects that have resulted in the difference that we have made. My Ugandan name is Chirabo, which means gift in one of the local languages. So my name reminds me every day about the important work that we do, the opportunities we have to make an impact, and that with passion and perseverance so much can be done, however daunting. This is my research with relevance, highlighting and addressing the needs of the vulnerable youth who live in the shadows of the 7 hills in Kampala, Uganda. But so much of my own work fits seamlessly into the research priorities and strength that we have in the Wellstar College. We address health disparities, we improve well-being and health of vulnerable populations, and we seek to uplift those who are underserved. In my mind, I can't imagine doing anything more important or fulfilling than what we do together in the Wellstar College.